Step into the illuminated darkroom where I shine a light on breast-related topics and beyond. I'm Dr. Efi McCurley, a general radiologist with over 20 years of experience in breast imaging. In this podcast, we'll explore the diverse and unique patient journeys, share insights, and empower listeners with knowledge. Join me as we dive into candid, real conversations that illuminate the path to better breast health.
Okay, sounds good.
All right, I am here with Jody Stoski, and before I get started, I'm going to read and introduce her to our listeners. It's rare to find a profession that lets you explore your true passion of helping others while using your unique skills. I have with me here Jody Stoski, the founder of Jody Stoski Paramedical Tattoo Academy and Cinnamon Girl Clinic, and her career allows her to do just that. Jody is originally a professional makeup artist and trained in permanent makeup and paramedical tattooing in 2007, opening at Cinnamon Girl Clinic in 2008. She has served well over 10,000 cosmetic and paramedical clients, quickly becoming recognized as an industry leader while continuing to invest in training and professional development along the way. Love that. Jody has served as a board member of the American Academy of Micropigmentation and has partners with doctors and plastic surgeons offering informative sessions at local hospitals regarding the various options available to those recovering from injury or trauma. In 2019, Jody built an online training academy to train experienced tattoo artists how to tattoo to camouflage and revise signs of past trauma in their markets. And since the launch of the academy in early 2020, she has acquired more than 3,000 students in over 40 countries. She's been featured in BuzzFeed, Yahoo Finance, and The Mirror in UK, CTV National News Canada, and numerous other international and local publications. So I have a star in front of me. I'm so excited to have you here. Welcome to the Illuminated Darkroom podcast.
Well, thank you. What an introduction. And I could not be happier to be here.
Well, thanks. And I want to say happy belated Women's Entrepreneurship Day. It was yesterday. I don't know if you know anything about that.
You know what? I didn't. So thank you. And same to you.
Thank you. It's a thing. I saw it on Instagram, so I was like, this is perfect. I'm gonna tell you about that, right? Okay. Well, I often start off by asking people what the meaning of their name is. Now, I don't know if you know what Jody means at all, do you?
I do not.
Okay. So I did look into it, and it says it means God will increase, or God is gracious and praised. So it's considered a contemporary diminutive of the slightly more formal and classic names Joanna, Judith, Jude, and Joseph. So, well, there you go.
Just learned something new. You know what? The only thing I could relate to in any type of form is I'm a Libra, and I know like the background of Libras, but not my name specifically. So thank you.
Well, you're welcome. I always ask that because I'm of African origin and names always have meanings, right? So,
yeah.
Okay. So let me ask you, where are you from, Jody?
I'm from Calgary, Alberta, Canada. I was born and raised here. And yeah, my brick and mortar business is here in Calgary. And then my online academy is just that. And like you had mentioned earlier, we have over 3,000 students in over 40 different countries. So that's kind of everywhere, but in Calgary, in person.
Physically, yeah. No, that's amazing. We're both in Calgary. You do know I'm in Calgary, right?
I do know that, yes.
Yeah, so I think it's kind of amazing. We're enjoying the same cold weather.
Yeah,
this morning.
Absolutely.
I slipped through an intersection this morning. Thankfully, there was nobody there. The roads are still sketchy, hey?
Yes, they certainly are.
Okay, so you are a paramedical tattoo artist and a permanent makeup artist. So before telling us how you got there, could you please tell our listeners what a paramedical tattoo artist is and how it differs from, say, a regular tattoo or cosmetic artist?
Mm-hmm. So a paramedical tattoo artist is someone who is looking to tattoo features back that have usually been lost through injury or illness. And what I mean by that is, for example, an injury like a car accident, and maybe you had a lot of stitches in your face and part of that took your eyebrow. So we would be looking to simulate that back in so that it does look hyper realistic. Or let's just jump into cosmetic, like plastic surgery. You had a facelift or a tummy tuck. We are able to camouflage those scars. So that wouldn't necessarily be replacing a feature, but making it look back to skin again. And then we also, so we've got injury and then illness. Illness, here's a relatable one: breast cancer, of course, you know all about
Mhm.
that. So post mastectomy, depending on their surgery, but typically they are not left with any areolas. So we would go ahead and tattoo a 3D hyper realistic areola tattoo. And that all of these things can close a chapter on, a very stressful, emotional, anxiety causing time.
Yeah, no doubt. Thank you for that. I've heard of the term nipple areolar restoration artist. Is that just a
Mhm.
branch under paramedical tattooing? Or are they
Yeah,
just people that just do just that?
I mean, if they're calling themselves that, I would assume that
Mm-hmm.
that's probably what they do. A lot of these other artists possibly would have scar camouflage tattooing in their repertoire because, for
Mm-hmm.
example, with areolas, it's like peanut butter and jelly. You have an areola that you need to do, there will be a scar that accompanies that. That often, again, like, it's sort of the full meal deal if you can go ahead and camouflage the scar and give that 3D image of an areola.
Yeah, interesting. Yeah. Now, is this something that you've always wanted to do? I know that you were involved in makeup artistry pretty early in your when you were in high school, I think, right?
Yes.
That's amazing. How
Yeah,
did
I
you
mean,
start?
well, I guess so. Back in the days when I was a makeup artist,
Mm-hmm.
I've just always been very creative, and it was something that I did kind of as a side hustle. I graduated in business and marketing, but that never really seemed to be the path that I ended up on. I was always like kind of heading more towards those creative outlets, and makeup artistry was one of them. And while I was doing that, I'd work in Europe, doing a lot of runway shows, wedding makeups on the weekend, and then I worked in television as well, doing news anchors. And I was approached by a physician while I was in the midst of this who couldn't practice medicine when she came to Canada. So
Mm-hmm.
she started doing this, and along the way, she asked if I would be interested in apprenticing her. And that's how the whole thing got started. It was kind of a unique, kind of game changer for my career. I never anticipated, I never could imagine I'd be where I am today, but here we are.
Yeah, that's amazing. Just felt like, yeah, that's pretty amazing. I know that you yourself have a unique story regarding paramedical tattooing, and I will let you tell that story to the listeners. It's pretty impressive.
Yeah. I think one of the things that people remember about me is when I tell them, in 2013, I was diagnosed with thyroid cancer, and
Hmm.
that required a complete thyroidectomy, which left me with a fairly noticeable, long, angry looking scar on my neck. And I was already doing paramedical tattooing at the time, but I didn't think it was going to affect me the way that it did. I suddenly thought and felt self-conscious. I was talking to
Hmm.
people, I can see them staring at my neck, and I thought, oh my God, I'm actually feeling self-conscious about this. I never thought that would be an emotion that came up for me. I was just proud to, get through it, and I just
Hmm.
didn't envision those feelings. And so what I did when the scar was at an acceptable healed state, I started doing my own paramedical tattooing on it and exercising those skills that I had learned to virtually, make that scar look invisible. So, a lot of people look at those before and afters, and that's been something that's captured the media's attention as well.
Hmm.
It's so graphic, right? When people see that, they're like, oh my God, I need to take a second look there. And I think with
Yeah.
paramedical tattooing, that's one of the really cool things about it is people just immediately are blown away. It's like even when you are walking down the street and there's an artist that's painted something
Yeah.
on the sidewalk and it looks three-dimensional, like it's a hole or another set of steps. It's just like your brain just kind of stops and goes, what?
Wow.
Like, oh my
Yeah.
God, yeah. So it's definitely, yeah, something I'm very passionate about, and really got that understanding of that firsthand how my clients felt just
Hmm.
going through it myself.
Yeah. It's definitely a unique perspective. I know you have some pictures online, and I looked. I was like, wow, like from where you started to, I mean, you can't see it. It's pretty
Yeah,
incredible. Yeah.
yeah.
Now, being in the field that I'm in, I was curious. I know that you said, because I did do some research, and of everything I read about you, I got the impression that you were in the cancer field before you got the thyroid cancer, but I could never quite understand what did you mean by that? What do you mean by you were in the cancer field?
I was working at a business called Compassionate Beauty, and they treated women who were going through and post cancer for all different things from, different bras and wigs to you name it, anything that had to deal with cancer from like lymphoma or what's the word I'm looking for? Draining the fluid, lymphatic
Lymphedema.
massage.
Yeah, yeah.
Yes, that, and I was there doing tattoos on people that have been through this. So I was quite deeply involved in that community.
Okay.
And that is also how I started making a lot of relationships with the oncology doctors in Calgary.
Mm. Would you believe they're my neighbors?
Is that right?
Yeah, we're in the same strip lot.
Oh my God, no way. That's
Yeah. I mean,
hilarious.
I don't know when you were here, but they've changed ownership, but I just love them.
Yes.
Like, they're
Yeah.
awesome. Yeah, pretty
Yes.
amazing.
I've tattooed the new owner from there. She's a sweetheart.
Yeah, she really is. Cool. And um, can you tell me, how did you discover that you had thyroid cancer? Like, is it something you felt or?
No, it's a common question, and I feel kind of silly thinking back. I kind of felt like my neck was starting to get a bit, swollen, and I'm
Mm,
looking in pictures once in a while. I'm like, my neck is looking thick. Like, what is that about? But I had no signs as far as like issues with my thyroid levels, anything like that. But when I was going for a physical, my doctor was feeling my throat, obviously checking my thyroid gland, and she's like, your thyroid gland seems enlarged. And that was like the first time I'd ever heard of that, but it kind of clicked. I was like, oh, that must be why my neck is feeling sort of thicker.
mhm.
And that led to tests and ultrasounds and biopsies and then eventually surgery.
Okay. Yeah, I wanted to ask you that because I think it's also an opportunity for people to know what to look for. I mean, I
Mm-hmm.
think a few weeks ago I had a young girl, her neck was like you could see it,
Yeah.
but she didn't notice it. And then
Yeah.
she went to a family physician, and I biopsied that, and it was thyroid cancer. So
Yeah.
it's, yeah, so it's just kind of good for people to know. And for sure, I think being having gone through that, it really puts you in a unique position for empathy
Mm-hmm.
for, the patients that you work with. Yeah.
Oh, absolutely. I mean, I think I'm a really empathetic person by nature, but
Hmm.
it does expose you to something that when you uniquely experience that yourself, that it's
Hmm.
sort of the next level of understanding.
Yeah, I can imagine. Now, I'm just going to get into the tattooing portion. I'm glad we talked about that. I'm glad you're okay. I want to focus on two things as it relates to the tattooing portion: breast cancer and restorative
Hmm.
treatment, and mental health.
Hmm.
Now, in relation to breast cancer, you're well known in this industry. How do people initially come to see you? I mean, when you first started and now, is this like referral thing? Can they just pick up the phone, call you? And is how long of a wait is it to see you?
So essentially, all of the above, as far as you sometimes get referred to me by physicians, which is very common. You might be doing a Google search and I come up and you find me that way. But also, just word of mouth, I think, has been a way that my business has grown exponentially. And I think it's like when you're passionate about something and that just comes through in your work and that word spreads around. So I'm very fortunate and blessed to have that part of it. And as far as when you can get into me, as far as booking, it can be anywhere from 1 to 3 months. It
Oh,
depends on what we're needing to do. But more importantly, is the scar needs to be healed for a year. So the bigger thing as far as booking with me is that will be our first check mark, is like, is it a year healed? Because it does take a full year, as you know, for a scar to heal. A lot of doctors, it's funny, they'll be like, you can go in 6 months. And then I'm like, you cannot.
yeah, I
Because
was looking online. They said 4 months. I was like, really?
yeah, the
Interesting.
thing is the tattoo process itself is somewhat invasive, and if the scar's still healing, I'm just potentially doing damage to something that's already kind of just trying to get along and get to its healed state. The
Hmm.
benefit of my damage when it's done in the proper timing is it helps re-stimulate that healing process, and I can get your body to do even more, um, just give it a bigger impact as far as the result goes with like different treatments, serums, massage, etc., to take it
Mhm.
to basically the best level that we can get it to appearance wise.
Okay, yeah, that's interesting. Now I'm thinking of a few things. So in that year, you would have expected, I imagine that if the patient's going through radiation therapy, that that's done and over with.
You bet.
Right. Okay. Cool.
And the radiation itself doesn't really affect anything, but it makes their tissue very thin and irritated. And you want to just give that a chance to recover as well, especially if they are getting any radiation burn.
Okay, that's interesting. And what about people that have the nipple mounds and
Hmm.
like the nipples that the plastic surgeons
Yeah.
create? What's the best
So
canvas for you, essentially?
I prefer a blank canvas, and I'll tell you why. Because when the nipple mounds are made,
Mhm.
first off, they're very rarely symmetrical, I find. And it's not for, a lack of the plastic surgeon, being careless. It's just it's when I see them, it's just not common for them to be symmetrical. So when I have to use those mounds as essentially like the middle of my areola tattoo and they're not looking symmetrical, I think it puts it off a little bit. It's not as
Mhm.
pleasing to the eye. When they are symmetrical, it can be great, but they also flatten over time as well. So I kind of have my opinion as far as what is a better canvas. I think a flat surfaces because you can create all the realism in the
Mhm.
world on a flat surface. You don't need the nipple mound. It's just strictly for projection. So if the woman wants that and just feels like that's going to make her feel whole again, we can totally work with it. It's not a tougher area for me to tattoo. It's
Okay.
just different.
So what makes the areola or the nipple, like what makes it 3D?
I mean, it's highlight, low light, and a midtone essentially. It's like when you're making anything look realistic, you need those three components to make it pop.
Mhm.
So it's in the details. It's
Okay.
when I say it's in the details, it's about knowing what will visually stand out, say from like a couple feet away from you. I find sometimes people get like so into the details, it's like
Mhm.
not realistic for you to be looking at something an inch away from your face. For
Right.
me, it's like I need this to look like 100% the feature. So
Mhm.
sometimes being a bit more basic in your artistry
Mhm.
can yield you a better result because tattoos will fade over time and you do lose those micro details. So although it's really impressive to see something up close, you're like looking at it like you would look at a piece of paper. I think the longevity and the realism comes from something simple.
Okay. Interesting. And you can simulate the Montgomery tubercles right on the areola as well.
Absolutely, yeah.
Yeah, that's pretty impressive. So how long would a consult with you take, and how long from beginning of like the consult to when the session is done?
Hmm. We offer free consultation. So there's a couple things that could happen. You might want to come in and meet me and hear what I have to say. But more commonly, people come in and we have that consultation and then do that appointment. It's kind of like two birds, one stone, but women have different comfort levels and a lot of people, do want to meet you. But if you're referred, I think that kind of puts your mind at ease. But
Yeah.
yeah, we can often just do the consult and the appointment in the same day.
Okay, cool. And is this a service that's covered by AHS, Alberta Health Services?
Unfortunately, it's not. Canada and their healthcare is a bit behind the times as far as that goes. In the US, there is a program now that they've started. You can bill paramedical tattoos and have them covered. The
Mhm.
only workaround in Canada would be like a healthcare spending account.
HSA.
Yeah,
I hope we can get there one day because this is such an important, service, you know?
absolutely. And I think it's so short sighted of them to think that that wouldn't be important to a woman.
Yeah. We're always just a step or more behind the US, so
Yes,
maybe
we
we'll get there.
certainly are.
Yeah, exactly. Yeah. Now, in terms of risk, actually, before I ask you that, so how much would it cost roughly?
So for a bilateral areola tattoo, and we're using tattoo ink. So this is like a one and done. You're not coming back for touch-ups or anything like that. It's $750. If
Okay.
it's a unilateral, it's $650.
Okay. Interesting. Cool. All right. And in terms of the risk factors, I imagine something like infection. do you say bleeding, or what do you tell patients?
The It's kind of like, what would be the infection rate of a paper cut?
Hmm.
It's obviously more invasive than that, but it's probably about a millimeter and a half into the epidermis.
Hmm.
Everything is sterile, obviously, and then we cover the wound with a tegaderm bandage. So essentially, it comes off in 5 to 7 days. It's healed underneath. I've never had an infection. My only caveat would be is if you have an allergy to adhesive and the tegaderm was not something that you could have, then we would have an ointment that you would use. But
Okay, cool. And does it hurt? Like, do you numb?
well, I can numb. I prefer not to, and the reason for that is it changes the integrity of the skin and it changes the way the ink goes into the skin. I
Mm.
do have a topical anesthetic if someone is kind of riding the struggle bus, but for tattooing scars, there's no sensation. Post mastectomy, most women can't feel anything.
Yeah.
If it's a flap, they can't feel anything. Where
Hmm.
there's sensitivity, and I think I have to kind of bust out the numbing, is more if it was like a cosmetic augmentation,
Okay.
because they just have an implant under there, right? So all the nerves and everything are typically fairly intact, where post mastectomy they're not.
Yeah, yeah, for sure. That's true. And do you notice any issues, let's say, if you have a patient that's smoking, like a smoker?
You know what? Surprisingly not. And another one that I'll hear people talk about sometimes is if you have diabetes, they won't tattoo you. I think
Mm,
sometimes like people just overcomplicate things. Those
yeah.
are not issues. And I think if you have experience and you know the precautions to take, it's not a big deal. People can be on blood thinners. I've tattooed people cosmetically, for example, eyebrows while they're going through chemotherapy. It's relatively safe. Everything, if it's slightly in question or they're not sure, it's like,
Mhm.
please check with your doctor first.
Yeah, for sure. Okay. And what is like, from the time you're done, what is the healing process? When is it, just good?
7 days.
Oh, that's
Yeah.
quick. I wasn't
Yeah, it's
expecting.
very quick. I would say for 10 days, like, don't swim, don't go in a hot tub, et cetera, hot yoga. But in 10 days, the skin will be healed.
Okay, neat. Now, I'm a radiologist. I'm going to ask you this question. We oftentimes, when we are consenting people for MRs, we always talk
Hmm.
about the ink, because some of
Yes.
the inks have ferrous substances in it, and if it's a fresh tattoo, it can burn. I've never seen it happen. I know it's a rare thing, but I mean, theoretically, it could happen. So, what kind of ink do you use? Is it the same for the nipple areolar restoration versus cosmetic? We even talk about eyeliners. I just kind of want to
Hmm.
know what your thoughts are about that.
Yeah, that's a great question. So for the face, I'm using pigments. They're called semi-permanent because they're designed to fade. I'm still implanting ink, so we still want to call that a tattoo. But
Okay.
as far as the difference in body inks versus cosmetic, or body inks versus cosmetic inks, is the
Hmm.
size of the molecules. And in a body tattoo, the molecules are much bigger, allowing it to stay in the skin essentially permanently. So the ink that we're using on the face is different than on the breast slash body.
Hmm.
And as far as MRIs or anything goes that we're thinking on the same lines of like it could have a burn, I have never in probably 15,000 tattoos come across that. And not to say there's probably a very small percentage of them needing those services as far as MRI goes, but I have never heard of that. I don't even know if that's like an old wives' tale, to be honest, because I don't know when this has happened.
Yeah, I've seen it in a textbook, and
Same.
yeah, I think what we say, wait 6 weeks, because
Yeah.
you never know. It's just going to be that one person,
Hmm.
or sometimes we tell them you might feel a sensation of heat.
Yes.
Yeah, it doesn't
And
necessarily mean it'll
heat,
burn.
I think is common, but to say a burn seems really extreme. But
Yeah,
again, it just takes that one person, right?
yeah, exactly, for sure. Okay, do people, like, do you allow a friend in the room? Do people have nipple tattoo parties? Like, what's the environment like?
I mean, I don't, back in my earlier days, I would allow people to come in that were kind of celebrating their friend. It reminds me of like someone's shaving their head, pre-treatment or whatever, and they have all their friends and they're drinking wine and whatever. It is not that. It is a clinical, sterile environment. I allow one person in with them. They need to stay seated in the room. I don't want people like lingering around my ink, my needles, and all that stuff. So it's more that environment, and I want them to feel comfortable and safe. It's very private. Um, I like it to be intimate like that. And
Yeah.
to be honest, I don't really have a lot of people that come in that like want to bring all their friends in. It's usually like a husband, if anything.
Okay, interesting. Do you find that people tend to sort of talk about their journey as that's going on, or is
Oh my
it?
God, always. So there's like a lot of tears shed, there's a lot of laughter, but I always hear the story. I think that person is in a vulnerable state to start with, and then they're in an even more vulnerable state with me, being exposed and doing that tattoo. And I think people just immediately feel like that's an okay place to share their
Yeah,
story.
yeah, safe space. Yeah,
Hmm.
that's interesting. I can imagine. As it relates to melanated people like myself,
Hmm. Yes.
was really wanting to ask you this question because it's a challenge, like
Yeah.
if we have scars, I've tried to do laser, they say, oh, now, yeah, now we have lasers for our skin, not really have been burnt. You know that
Hmm.
sometimes when we're traumatized, skin is traumatized, either hypopigments or hyperpigments.
Hmm.
So I'm just wondering, do you have any experience working on, black, brown people? Is there any difference in with us versus say like white people?
So higher Fitzpatrick 4, 5, and 6 are considered, that melanin rich skin type that has to be treated with a little bit more caution when it comes to camouflage. Not with cosmetic tattooing. It's fine. It's all the same. It's about like, picking the proper colors and knowing how they're going to age. But when we're dealing with anything on the body, especially with scar camouflage, we have a completely different system. And I have worked with a lot of these higher Fitzpatricks, and I get great results. The only caveat is no keloid scars. We can't work on keloids, which would be more of that popular population that's going to come with that issue. But a lot of
Hmm.
keloids are, I think people think are keloids, and they're actually just a hypertrophic scar.
Yeah.
So we can do, and there's a fine line. If I'm working on something and it is most certainly keloid, I won't be working on that. But if I'm kind of like it's sort of borderline, it looks more hypertrophic to me. For myself, because I've been doing it for a long time, I'll treat that area with caution or a test patch. But I recently launched a dark scar camouflage course for exactly this reason, because in the past, it was just this disaster with, these higher Fitzpatricks when trying to do something like whether it was stretch marks, scar camouflage, um, just a whole melting pot of messes. And now, with a lot of experience, I figured out a method to do it. And there's specific inks and serums that go along with that. And
Mhm.
there's also a PIH protocol, which is post inflammatory hyperpigmentation, because a lot of times you'll still endure that hyperpigmentation, but it's short lasting. It's just your
Mhm.
skin's healing response to hyperpigment, and then that goes away. The important thing is that it's not damage done that's never going to go away.
Yeah. Well, that's interesting to know because I had a scar that I wanted to cover, and I don't keloid, but a hypertrophy scar, and I had to do a combination of laser and injections, 5
Yeah.
fu catalog. It was a
Hmm.
process, and
Yeah.
I kind of wish I knew about the scar camouflage because
Hmm.
I'm not a keloider, but a hypertrophy scar. So
Yeah.
that's really good to hear about the course too, because it's very much needed here. You know.
Absolutely. And it depends where you live. Like you might have a really big population of higher Fitzpatrick, and up until recently, I think you would, if you were somebody like me, you'd be turning away a ton of people and not be able to help them because it was just like
Mhm.
likely I'm going to make a mess. Your best suggestion was go for a cortisone shot,
Mhm.
use hydroquinone, all the things that everyone's done for 100 years that may or may not work. And I think the improvement was marginal. And then sometimes then you'd hypopigment over it. And, there was just a host of things that could
Yeah.
happen.
Oh, okay. That's really cool. So, do you often end up, or do you find yourself fixing other people's works?
Yes, I sure do. So I think with cosmetic tattooing, that was something I still do it a lot. I'm not going to lie,
Mhm.
because it's a little bit of the wild, wild west to be able to get into this industry. And what I mean by that is, as a radiologist, you could say, well, you know what? Tomorrow I want to be a paramedical tattoo artist, or I want to be a cosmetic tattoo artist. There's no governing body that's going to say, hey, you actually can't do that. You're going to need this, and that to get into
Mm.
the field. So it, I think it attracts people sometimes that feel like, I don't know, I need a career change, or I want to do something creative, or so I want to do something that means something. And while I respect and honor those things, it's not the industry to be going rogue in. And that is why there's a lot of corrective work that needs to be done in both paramedical and cosmetic. I think now that cosmetic tattooing is so mainstream,
Mhm.
I don't want to say there's less of it, but there's better artists out there with more experience.
Mhm.
I have a huge clientele of work that needs to be corrected, so there's no question about that. But I
Mhm.
think also because we have been probably one of the first clinics in Calgary to
Mhm.
do this. We have a great reputation, and I think that really lends itself to, like, these are probably the people who are going to be able to help me, not someone who's, just started a year ago or a month ago or whatever.
Yeah, it's pretty scary when things aren't regulated. So if someone is looking to get their nipples restored, what should they look for? What kind of questions should they ask?
I think it would be, I mean, when you're coming from that place, the questions are typically, when can I do this? And like, other than those logistics, let's park that for a second.
Okay.
What that person should be looking for is an artist that their work speaks to them. So they
Mm.
need to look at what their paramedical profile looks like and their experience. Those
Mm.
would be the two determining factors of who your artist is. Um, and then meeting them, just to make sure you click with them. But at the end of the day, it's artwork that you're going to wear and you're going to, want to be proud of. So you don't want someone who's going to boss you into something that, like, I didn't even really want that size or that color
Yeah.
or whatever. You want someone who's really going to respect and honor what you want. And you might have a picture from before, or you might say, you know what, my areolas were way too big. I do not want that again. I want
Hmm.
something more pinky and small, or whatever that might be. So I think those are the real important things. And then from a logistical standpoint and a medical standpoint, you're just looking for the scars to be healed, especially if the scars are running laterally through the areola, which they often will be.
Yeah.
So that's where it's really important that those are healed. But for example, if you had a flap done, those scars don't even intersect with my areola. So you could have it done much sooner. And yeah, just making sure that you've taken good care of that skin. And the rest is up to the tattoo artist to do a good job, have a safe and clean environment. And that's
Hmm.
pretty much it.
That's cool. Well, so to that end, can you tell us a bit about the paramedical your academy?
Yeah, absolutely. I'd love to. So,
So you brought a smile to your face.
I
You
do love
can
it.
tell
I
you're
do love
passionate
it.
about it.
Well, you know what? I think when I started doing this, there was such a shortage and a lack of knowledge that this existed. And I was like, I wish more people did this. I wish that, this was more available to people. And I'd have people fly in all the time to come see me. And as amazing as that is, it's just like, man, you shouldn't have to fly here to get this. This should be
Yeah.
like, even how you and I were talking about, like, it should be covered. Yes, it should be
Yeah.
covered. And so I'm passionate about other people learning how to do this so they can, heal their community with the power of paramedical tattoos. And when I had this epiphany, oh, I want to do this, but I just thought, how am I going to teach people how to do
Hmm.
this? It seemed overwhelming. I knew how long it took me to figure it out, and I basically taught myself. Other than what I learned, I just kind of had to keep figuring it
Hmm.
out, and I wanted to shorten that learning curve for people, and I knew I could. I just didn't know how I would go about it. So before COVID hit, the timing was impeccable because I started writing an outline of how I could put together an online training academy to teach people how to do this. And
Hmm.
it was just like pages upon pages and pages. And I'm just like, oh, this is
How's
this
this
is
going to
not
happen?
conducive and I'm just going to overwhelm people. How do I break this down? And so through, a lot of blood, sweat and tears, it was a very big baby to birth, but eventually I got this curriculum down to what I felt would have guided me. So what did I need when I was starting out? And that's how I built the academy. And it started off with 3 courses, and now I think we have 9 or 12 on there. But
Mm,
it teaches someone with tattoo machine experience. So you might be a cosmetic tattooer or a body tattooer
mhm.
wanting to learn how to do this. So I just don't take somebody off the street and teach them, although I do have a mentorship program for that,
Okay.
but I won't get into that.
Yeah.
Most people come and see me through the online academy, get through the courses. There's a study hall that's included with that after, that's has hundreds of students in there, that is very active, sharing wins, lessons, how do we do this?
Hmm.
What did you do? Which is so amazing because you're basically continuing to educate yourself through people's experiences, which is really
Hmm.
unique. And that has blown up. And I feel so excited and fulfilled that I've
Hmm.
been able to do that. And it's been something that's well received, and we get such good feedback from students. Like, for example, people who have done in-person courses that take my course feel like they've gotten 1,000 times more education through an online training program. And I think one of the things that really helped catapult this into
Hmm.
the success that it's been is COVID forced everybody to have to learn on that platform, where before
Yeah.
it was, it existed, but it isn't what it is today. So being able to have a successful online academy to get somebody into a position like I'm in is super rewarding. And I just love seeing, all their successes, and them being able to feel that same gratitude that
Yeah.
I get every day at work. I feel I am very passionate about being able to do that. And you're basically giving, your gift is confidence. And
Yeah.
that's something that is pretty incredible to be able to do every day. So, yeah, I mean, I've never really felt like work is work for me.
Yeah. I looked at it and I looked at the reviews and they seemed pretty amazing. So highly recommend. I just love that you're doing that.
Thank
It's
you.
amazing. Yeah. I was going to shift a little bit to mental health. What is it about? And I think we've kind of touched on it a little bit. What is it about nipple tattooing? Why do you think it's such a thing of completion for women or breast cancer survivors?
Well, as women, part of how we identify as a woman is our breasts, right? And so I think when you have to, and everybody's different, right? Like, this isn't a one size fits all. And I don't want to paint everyone who is going through breast cancer or who has had a mastectomy that they should feel like this or that they do feel like this. But my consensus is that when a woman has to have her breast reconstructed, that can be very life altering just in itself. And then
Mhm.
to top it off, you have no areolas. So I think from a mental health standpoint, depending where you're at in that journey, whether that's really affected you or not, walking past the mirror every morning to get in the shower can be such a huge reminder of a journey that probably scared the life out of you and potentially traumatized you. And one of the biggest parts of healing is being able to forget that. And the only way to forget that is to not get caught up in that mirror every time you walk to the shower as a
Yeah.
reminder, oh my God, right? I don't have any areolas. And when you put that on, I'd mentioned earlier, it's like closing the chapter on that part of your life. And it's Barbie boobs versus personalizing it, getting it back to you. And that there's no comparison for people. I even have clients that come in. I recently had one she was post recovery 5 years and then another one 10 years ago and
Mhm.
decided to get areolas. Like, clearly didn't bother them. They're like, my husband
Mhm.
doesn't care. I don't care. And then suddenly one day they just thought, no, you know what? I want this now.
Yeah.
So it's a different path for everybody, for sure. But again, there's no right answer. I think the biggest thing is losing the reminder if a naked breast is a trigger for you.
Yeah. It's interesting you say that. I know I've read of women that they don't look at themselves in the mirror.
Oh,
And I
yeah.
think how sad, but at the
Yeah.
same time, like you said, there are people that have these aesthetic flat closures and they're just fine with that and pro
hmm
that. So it's not for everybody, but for those that want it, that's just an amazing thing.
I even have clients that will come in that have just been diagnosed, and that's their biggest worry. So they want to
Oh.
come in and talk to me. They haven't even been through treatment. So again,
Mm.
there's a spectrum of how intense that can be for somebody. And, I want to respect that for everybody, whether you're coming in 10 years later or you're coming in because your treatment hasn't even started. And that's like one of your top concerns. So,
Yeah, I agree. And even though we're talking about breast cancer, I know that you also work on other people, like, self-harm
mhm.
and I think I thought that's incredible.
Self-harm is one of my most popular camouflage services,
Oh.
and that's probably top of the charts for triggering with a stage of life and where they were at, and that's never a positive one when it comes to self-harm.
Hmm.
So again, to be able to erase some of those memories for people, that gives them the ability to step forward. And it's a lot of younger girls, to be honest, and
Mm.
a case that comes to mind is a girl who always wore long sleeves, and she had her grade 12 grad coming up, and after we finished her treatment she wore a strapless dress to grad, and I was like,
Aw,
you know what,
that's amazing.
how incredible for her to have that confidence back. And yeah, that's what keeps the dream alive for me, is just being able to
Yeah.
do that for people all the time.
Yeah, it's a huge difference. What would you say is the most challenging part of what you do?
I mean, I don't look at it so much as challenging. I find it difficult to turn people away when they have keloids, because I can see the desperation, and they know that they're really out of options. And I feel like when people show up and they've kind of read about me, they think I have magic wands. And
Mm.
as much as sometimes it can be like that or look like that, I can't help everybody, and I can't get the improvement is again, it's a spectrum, it's a percentage. Like maybe I can only improve this 50%, maybe I can improve it 99%. So it's like managing expectations with people, because again, looking at someone's portfolio, I like to put everything out there so that you can see that there is different percentages of improvement.
Hmm.
And I'm an open book. I want to put my cards on the table and say, hey, like if you're going to spend this money, would you be okay with the 50% improvement? But one of the best things about paramedical tattooing is people are looking for improvement. They're not looking for perfection. So a day in my life when it comes to cosmetic tattooing, people are like, I need one hair here. Like we are micromanaging millimeters.
Yeah.
With paramedical tattooing, it's not like that. It's not like that at
Yeah.
all. And it's nice for me. It's a nice balance for me because I am just OCD with the details, but also it's nice to come from a place too that people are like just so grateful with
Yeah.
maybe not that 100% improvement, although that is obviously what I'm going for each time. And then probably lastly, the thing is just educating people and doing things like this, as talking about it and letting people know these services exist, because up until now, paramedical tattooing, people would be like, para what? Like
Yeah.
they don't even know that exists, right? And it was
Yeah.
like that with cosmetic tattooing. Now it's like, oh, I had my eyebrows tattooed. They're like, cool, so did I. Everyone knows
Mm-hmm.
about that. But with paramedical tattooing, everyone says, so, well, what is that? What does that mean? And I have to explain the tattoo in order for them to go, oh, okay. Usually it's followed by, I didn't know that exists, which makes me sad. And I guess for me, just one of the things, obviously, it was when you show someone a picture like, this is what I do, they're like, oh my God. And that will be something, they'll go and tell 10 people.
Yeah, it's pretty
And
impressive.
yeah, I think paramedical tattooing, it's definitely out of its infancy, but it still needs more wheels. That I want it to eventually be like cosmetic tattooing. You're like, oh yeah, I know, my friend had that or whatever.
Hmm.
But right now it's like you don't know about paramedical tattooing unless you need to know about it.
Yeah.
So maybe you know someone that's gone through breast cancer, or you yourself have, and then
Hmm.
you are in the mainstream of paramedical tattooing world. But
Yeah.
yeah, if you don't know, you don't know.
Yeah, exactly. Yeah, no. Well, I was going to ask you to if you can have a story that really touched you, other than because I like I said, I read a lot. The cleft palate story was pretty
Mm,
amazing,
yes.
and you've just mentioned about the girl with the long sleeve shirt. Any
Hmm.
breast cancer stories that patients that, or any story that really touched you?
Well, honestly, I could like go on all day about them because they're almost always like that, to be
Yeah.
honest. But ones, I'll tell you another one that stands out. I talk about this one a lot 'cause it's pretty cool. It was a pilot that went into his dermatologist to get a biopsy on, something that they were testing. And you know how when they're doing that, they just continue to cut until the margins are clear.
Mm-hmm.
And his doctor, in what I understand, wasn't very clear in what that could potentially look like. So they were working on the quarter upper section of his lip and continued to cut and cut and cut. And I mean, he's numb, so he doesn't know exactly what happens. But when they finally get a clear margin, the
Mm-hmm.
entire quarter of his lip is missing. All his teeth, his gums are exposed. And I mean, I
Oh
can't
gosh.
think of a more disfiguring image when, and again, like he seemed very shocked at that. So obviously I wasn't there for the conversation with the physician, but
Mm-hmm.
he was just like, oh my God, he had to go on leave for work, start antidepressants. They did a skin graft from his neck to replace that skin, but the beard was now growing through where the lip was supposed to be. So then he had to get the hair lasered off the lip because the beard from his neck was part of that graft,
Right.
right? So
Yeah.
they couldn't contour it and make it so specific that, okay, well, this part of the neck skin doesn't grow any hair. Let's use that part of the flap for the lip area.
Mm-hmm.
So once he was done lasering it, and they were kind of as specific as they could be. He came to me and I retattooed his lip on to match the other upper quarter, and then
Mm-hmm.
I stippled in beard all around that
Mm,
area. So
amazing.
he was then going to always be like kind of the 5 o'clock shadow look. Plus, it helped conceal the scar. So we tattooed the skin graft into the same color. I stippled the beard into it. I got him the lip that matched the other side of the lip, and he eventually got off his antidepressants and went back to being a pilot, which I was like, yay, how
Score.
great.
Yes.
Such
That's
a
a
score.
win. Yeah.
Yes. Big,
That's a
big
huge win.
W.
Yes,
Yeah.
yes, yes, yes. I love that. That's amazing. Um, I we talked a little bit about Kevin just before I started recording. So I want
Yeah.
people to know you work with your husband. You said a little bit your family. Kevin's awesome, everybody. Like he's a rock star. You tell him that. I'm a fan.
Yes, I will. Everyone loves him. He's a super smart guy, and he was in oil and gas corporate in procurement forever. And when COVID hit and my business just continued to grow and grow, I was like, you know what? I like, would you be interested in doing this stuff? It's stuff that I hate. I don't know how to do it. I'm just like spinning my wheels, hiring people that I then have to micromanage and, you know, all the rest of the stuff that comes along with it. And
Mhm.
yeah, it was just a place and time that worked out for us. And I'd like to say we're still happily married, which was, a gamble.
Yes,
But
that's important because working together. I mean, yeah.
him and I do very different things, though. For example, he runs both businesses, Cinnamon Girl Clinic and the Academy.
Okay.
Everything logistically, everything behind the scenes, all
Mm.
the social media. And we have a marketing team. Some of them are in Houston, the Philippines.
Oh
He
wow.
orchestrates all that. He runs like just everything. I'm just the artist. I'm just like the face of the business. He does everything else.
Yeah.
And he's so good at it. And yeah, I couldn't do
Yeah,
it without
he's on
him.
point.
Yeah.
Yeah, he's
Yeah.
absolutely on point.
Yeah. He's a good one.
And your boy mom?
I am a boy mom. I have two boys, Ryder, who's 20, and Lincoln, who's 16.
Okay.
And yeah, it's a full-time sausage party at my house, and I love it.
But you're around girls a lot at work, I bet you, right?
I am.
So
Yeah.
actually,
I
I,
do.
I looked at your page, and yeah, it's a huge girl crew around you, and they look like strong women, like great bios. Are there any men in this field? Just out of curiosity.
the men that are in my field more commonly
Mhm.
do SMP, which stands for scalp micropigmentation. It's when you're stippling in little dots of color to mimic a shaved head, similar to what I was just telling you about the beard.
Mm.
So you're putting little impressions into the skin that look like a stubble that's there. So,
Oh.
even for someone like alopecia, we could do a whole head to make it look like that,
Hmm.
or a receding hairline, or cul-de-sac, baldness, whatever. One of our artists does that. Obviously, she's female, but that would be
Hmm.
the more common male end of this industry, not so much the cosmetic.
Hmm. Interesting. Now, jumping around a bit, but like if you go to get implants, sometimes they
Mm-hmm.
will do this computer generated thing to have
Mm-hmm.
you see what you're going to look like. Has AI or technology influenced your world some at all?
Not at all in that regard. And I'd have a hard time understanding how they would get there for the mere reason that everyone is going to respond differently. I'm not saying, hey, here's your 300 cc implant. This is what it will look like on your figure, because those are just numbers, right? With
Hmm.
a tattoo and how you heal and what your scar looks like, the results will vary. And the amount of treatment time can vary, and it will continue to change, etc. So it would be tough. I feel like it would maybe create some false expectations
Hmm.
in people to be like, well, look, wow, the scar will be gone. And maybe it won't be. Maybe I got a 70% improvement. So although it would be great if it could calculate it, I don't know how that would work yet.
No, this is good. We don't want AI to take over the world.
You bet,
No,
girl.
exactly right. Okay, three not so random questions. What are your thoughts on heart shaped areolas?
Oh, I love them. I think they're so cute. It's something that I hear women say, "Oh, I'm going to get those," and then when it comes down to it, they don't. At the
What?
at the end of the day, I just think women, after you've been through everything, are like, "Well, you know what? I just need normal. I just want basic, get me back to point A here."
Yeah.
And I don't do them that often. I think they're so fun and so cute
Yeah.
though, but it's not common. And my clientele with areolas is probably women in their 50s and above. So I think that adventurous factor starts to fade out.
Done. It's like no more heart shaped tattoo. Yeah. Okay. Pretty
Yeah,
cool.
yeah.
Okay. Second question. What are your thoughts on the Skims bra? The ultimate nipple Skims bra?
Oh my God, good question. At first I was like, oh, okay. I think it's cool. Would I wear it myself? No, I think I'd feel uncomfortable with it, but more power to you. If you want to wear it, I think it's kind of a great idea. And yeah, yeah, you know
Yeah.
what? Whatever floats your boat, I'm on board.
Yeah. I saw that for the first time and I looked at the comments and, people are like, well, I don't want people looking at me or drawing attention to me. But with the line of work I'm in, I thought to myself, if you don't have a nipple and one day you're walking and someone just like double takes, just that's pretty cool.
Yeah. Yeah,
It's that
absolutely. Like
confidence.
100%.
Yeah, whatever floats your boat is right. Yeah. Okay. Do you do you have a favorite song playlist that you work to?
Oh, yeah. Okay, so we listen to Spotify, and I wish I knew the name of the playlist, but I freaking love it. It's different every day, and everyone comments how great our music is. It's like a collab of honestly everything. And
Yeah.
so many people resonate with it because our clientele is probably like between 30 and 60.
Mhm.
And so, yeah, like the younger ladies like it, the older ladies like it. We get asked all the time. But the reason I don't know it is because one of my front end girls always goes and checks, and I don't know. Maybe I'll send it to you. You can put it in the show
That would be
notes.
awesome because I teach
I'll
spin
do
and
it.
I'm always looking for like good music. Yeah.
Okay, well, this wouldn't be like spin music, but
Well, you never know.
this.
We can do a lot of things with like there's lots.
Okay, all right, I feel you. I'm gonna send it to you. I'll
Yeah.
find it.
Okay, that'd be
Um,
awesome.
Sidebar: would you wear the Skims bra?
Man, like I'm not opposed. It wouldn't be like an
Yeah,
everyday thing, but like maybe one day I'd just go out with my husband and yeah, I'm not opposed to it.
yeah,
It's not gonna
yeah.
be definitely not an everyday thing for me, but I super strongly, like so strongly just love it for an alternative for women that that don't have that, because I
Mhm.
see it every day, and I see, like, I know the impact to some degree. So I just loved it for that.
One of the things on the flip side of that is women really rave about not having the mound put on their breast because they can just go braless and it never.
True.
And so I think that's a big bonus as well. That would be something I'd be like, great, I don't have to wear a bra bonus.
Yeah, for sure. Oh, yeah, no, definite like advantages and disadvantages. But yeah, interesting. Like, I'll leave it in the notes, but I just wanted to know, how can people find you? I know you've mentioned this, the Cinnamon Girl Clinic right in Calgary, but your socials and
Hmm. So you can find us on Instagram for my academy, and that would be if you want to learn. And add paramedical tattooing to your business would be at Jody Stoski, Jodystoski. And if you want to have me tattoo you, you're going to find me at Cinnamon Girl Clinic, and that's on Instagram as well. You can find me on Facebook there, and it's even having something like a consultation. We have forms you fill out, you can send pictures in, and we can work through it,
yeah.
virtually with you if need be.
Yeah, you took the words out of my mouth. I was going to ask, can you do it virtually? Yeah.
Absolutely. Especially if people are flying in, which is not uncommon. And that's when, we'll already have had some pre conversations like, what are we going to do? What's the plan? What's the cost?
Mm-hmm.
Um, and then so that when they do come in, it's like, let's meet in person. Let's go through everything. Maybe I'm drawing on them, etc. Do all that stuff and then get cracking.
Hmm. Okay. Well, just coming to the end, I just want to say that one thing I really loved about you is you're so generous with your knowledge. And it particularly touched me because I know you made a concerted effort to, there's this spirit of competition that can happen. Is I want to keep it to myself, right? But
Hmm.
I know that
Hmm.
you made an effort to share it, and so that people can benefit from that knowledge and help a lot of people. So I just really love that.
Thank
Uh,
you. It's hard initially to have the spirit of community over competition, but
mm,
it did take me some time, but I got there, and it's a better place to be. Um, just just mentally, like I feel better sharing than trying to gatekeep things, and being in the position of educating people. It's like, what kind of an instructor would I be if I, oh, you're only going to pay me and I'm going to tell you this stuff. I do really like to share because I think it sparks interest and
mhm.
it gets more of it out there. So yeah, I'm a big advocate of sharing, and I think there's enough for everybody to go around. So
Yeah,
yeah, that's
yeah.
my thought.
Yeah, I really love that. Well, and another thing I love is quotes, and you have a quotes that are associated with each of your staff members. So I,
Yes.
I would thought I'd end on this note and with a couple quotes. So there's a quote from Coco Chanel which says, "A beauty begins the moment you decide to be yourself." And I want to say that your work truly embodies this sentiment as it helps women feel beautiful and confident in their own skin, especially after a difficult journey. And I want to thank you for your dedication and the inspiring work that you do. And just like the name of my podcast, you're helping to bring light to those who have faced darkness in different ways, and you leave them feeling confident and beautiful. And there's this quote by Maya Angelou,
Hmm.
which says that I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So I want to thank you for making women and people around the world feel beautiful inside and out.
Oh, what a great way to close. And I love that quote from her as well. I think of that often, and truer words of could not have been spoken.
Yeah, I really appreciate you doing this. And Jody Stoski, and I'm thank you for being here. And I'm looking forward to people listening. Thanks for the listeners, and thank you so much, Kevin.
I am gonna go out and give Kevin the biggest hug from you.
You definitely need to do that. Yes. Well, thank you so much for doing this, Jody. I truly appreciate it. It's been
You
an
bet.
honor.
Anytime. And likewise.
Thank you. All right, take care. Thanks for being a guest on my podcast, and to everyone that's listened, a huge thank you to you as well. I look forward to sharing the next episode with you. Please follow me on my social media platforms at Dr. Ify Women's Health for upcoming episodes and more. Please note that the discussions and opinions shared in this podcast should not be considered medical advice. If you have any concerns or symptoms, please consult your primary care physician.